Are you expecting a baby? Then you might have heard about a mucus plug. It may not be the most pleasant topic, but it's important to know what happens when you lose your mucus plug. In this video, we'll go over everything you need to know about the mucus plug and what to expect during this exciting time. What is the mucus plug? The mucus plug is a thick substance that forms in the cervix during pregnancy. It is made up of cervical mucus and various cells from the cervix. The mucus plug plays an important role in protecting the fetus from infection. It acts as a barrier to prevent harmful bacteria from entering the uterus and harming the developing fetus. Some women may lose their mucus plug before labor begins, which is a sign that the body is preparing for childbirth. However, losing the mucus plug does not necessarily mean that labor is imminent. It is important for pregnant women to be aware of the mucus plug and its function in order to understand the changes that occur in the body during pregnancy. Signs of losing your mucus plug. There are a few key changes to look out for during pregnancy that could indicate that labor is approaching. Two of these are changes in vaginal discharge and the appearance of the mucus plug. It's important to keep track of these changes and discuss them with your healthcare provider, as they can provide important information about the progress of your pregnancy. In addition to these changes, you may also experience other symptoms such as Braxton Hicks contractions, back pain, and a nesting instinct. It's important to pay attention to your body and communicate any concerns with your healthcare provider to ensure the health and safety of both you and your baby. When do you lose your mucus plug? Some additional information that may be useful to know about mucus plug loss is that it can occur at different times during pregnancy. While it is commonly associated with the onset of labor, it can also be lost weeks or even months before labor begins. It is also important to note that the loss of the mucus plug does not necessarily mean that labor is starting right away. It may be a sign that the cervix is starting to soften and dilate in preparation for labor, but it could still be days or even weeks before active labor begins. Understanding the difference between mucus plug loss and labor can also be helpful. While mucus plug loss is a sign that labor may be approaching, labor is characterized by regular contractions that lead to cervical dilation and the eventual delivery of the baby. What happens after losing your mucus plug? During pregnancy, it is important to prepare for the labor and delivery process. This may include attending childbirth education classes, creating a birth plan, and practicing relaxation techniques. It is also important to be aware of potential risks and complications that may arise during labor and delivery. Some of these risks may include preterm labor, preeclampsia, and fetal distress. Knowing the signs and symptoms of these complications can help ensure that prompt medical attention is received if necessary. Additionally, it is important to have a healthcare provider who can provide guidance and support throughout the pregnancy and during labor and delivery. Remember, monitoring changes in pregnancy is crucial for the health and safety of both you and your baby. If you found this video helpful, please subscribe to our channel for more informative content on pregnancy and childbirth. Thank you for watching.